Hello everyone, and wishing you a happy new year on my personal behalf and from everybody here at the Marrow SS team. This is our fifth year, so we launched the app sometime in 2021, mid to late 2021. So we are into the fifth year of the app, and we haven't had a face-off like this for quite some time due to many reasons. And I think now is the right time to actually come and tell you as to what is in stock and what is in offer and so many such things. So I don't personally believe that I need to be coming every single time and keep telling you about what's to be done and not to be done, because we're all very grown up people, so we very much know what your priorities are, and accordingly each one know how they can use the content. So let's try to have a discussion which is going to be centered around the upcoming NEET SS exam. So before we venture into that discussion on the upcoming NEET SS exam, let's just try to see as to how we have evolved as a team in total. So 21 is when we actually published the first list of videos. But remember, in those times, not those times, it's not like so far off, so far away, but still 5 years ago when we tried to come up with the app, the first major hurdle was that the exam pattern was not like this. The exam pattern was mainly subject centric, not like medicine centric. So we had those kind of issues, and then we came up with the first set of content, and then tried to change and revamp. 23, we added a lot of new content. We kind of brought in a few new teachers, etc., etc. And 23 was when we had the last of the NEET SS exam. So NEET SS exam is now happening after a long hiatus. That's why I'm saying the sun is shining again, because it's been quite a long time since this NEET SS exam has happened. And we have never thought of this app as an app for studying for NEET SS. That has never been the aim. This is to actually give you the highest quality content at your fingertips. I've tried to emulate that, something like what an up-to-date gives. But then reading up-to-date is not very easy. You've got to again go to this window, that window. And in a short period of time to get a complete know-how of hyperkalemia is not possible. So that's where the app actually comes into picture. The app is for anyone who wants to learn medicine the way it has to be. And for people like me who are not so pro in terms of reading textbooks, because textbook does give a lot of outdated content. Textbook doesn't really help us to treat patients. So basically we need to learn in a way that we can treat a patient. So that's the reason for trying to kind of replace textbook with something like this. So that's all been the aim. Now, what can we offer every time new to the student is a major challenge, or that's a major task. So 2023, we tried to change all the content and came up with something really new and kind of updated a lot of content, etc., etc. 2024 is a year where we have tried to replace some of these subjects wherein the feedbacks were not that great, but the original content has remained the same. So 2025 is a year where we're coming up with something called Gateway to Residency. Gateway to Residency is a plan of ours, more like a dream of ours, where we have tried to kind of help out students somewhere in the middle. That means a student who has passed this course really knows what he needs to use from this. A student who is preparing for his final year theory exam knows which videos to watch based on the past year question papers. A student who is preparing for a NEET SS exam really knows what he has to do from this, so there is no confusion. INISS, again, no confusion. The people who are really confused are those in the first and second year of their residency. So in your first and second year of residency, you generally sometimes are not too happy with your college, not too happy with your patients, sometimes not too happy with the kind of seat you got, etc., etc. So many times you really don't know what to learn and what not to learn. But again, you are a grown-up person, so it's hard to keep asking people as to what I should be doing and not doing. So here we have tried to give our perspective of what is residency. So my purview of what is residency is not going with the knee hammer and checking for the knee jerk. So that's not what I think is residency. Residency has so many aspects, has so many parts. It's our life and our decision on how to live with it. So like it's our residency and our decision on what to do with that. So you will have different aspects to it. So we'll be kind of making a lot of videos which can simulate or maybe go as real as possible or as close as possible to the original settings that we do have with respect to the patient, and help us try and treat a patient better. And that has always been our aim. So that's one plan that we have for 2025. So this particular face-off that we do have is to talk about the NEET SS exam, which is going to happen around 90 days from now on. So many of the students keep asking us to what to do for NEET SS exam and how we can actually tackle it and what are the plans, etc. So I am not somebody who can tell you that if you do this, you're going to crack the exam. I'm always trying to present you facts and how you actually look at facts and what you derive out of those facts are purely with respect to your intelligence. Let's try to look at some facts and let's try to see how we can tackle the exam. So before we go any step forward, always to know that this exam has a very short history. The exam till 21 was not like this. 22 we had an exam, 23 we had an exam, 24 we didn't have any exam. So whatever data that we can actually kind of make out is just based on 2 exams. So 2 exams is all what we have to actually kind of draw a lot of conclusions. So it's after a long hiatus that the exam is actually happening as well. Let us look into the pattern changes in the first instance. So the major pattern change, we've got 4 specialities now. More than 4 specialties, 4 groups now. So in this particular video, I'm just talking about the medicine group, but remember that we have a critical care group now, we have a medical oncology group now, and as usual, we have a pulmonology group. So they don't come into this category, they don't come into this particular zone of ours. And that also is a huge reminder for you to understand that these are different subjects now. They don't actually come under general medicine. So you can always go and do it as a specialty, but as a general medicine person, you are not expected to know much of oncology. You are not expected to know much of pulmonology, and not expected to know much of critical care. But you do understand that a lot of our lives during residency is spent in the ward where we see a lot of patients with respiratory issues, and a lot of our life is being spent in the ICU where we see a lot of patients with critical care illness. So that's a different perspective altogether. But for the entrance exam, we can actually keep them aside. We can keep them aside, and we are really not going to get much of questions from there because these are different groups now. As far as medicine group is concerned, we have 10 subjects. Okay, we divide these 10 subjects into 5 and 5. Out of this, the first 5 that I'm talking of are the subjects from where during the past exams and even now, we 100% believe that you're going to get 80% of the questions, and the remaining 5 from where you're going to get 20% of the questions. So this should be very clear, which means that these 5 subjects are where I need to be very thorough. I need to be going as much in detail as possible, because this is where the rank is going to come. So out of 150, 120 questions are likely to come from these 5 subjects, and those 5 subjects are Cardiology, Neurology, Nephrology, then the king subject, of course, Endocrinology and Metabolism, which is the biggest one, of course. And number 5 is liver, okay, Hepatology. So these are the 5 first line subjects, you can actually call them, where you get maximum number of questions. We also have 5 more subjects, which includes medical gastroenterology, rheumat, clinical hematology, infectious diseases, and we have medical genetics. So these are the other 5 subjects. Apart from these 5 subjects, you also have a villain here, that is biostatistics, which most of us haven't understood anything during our course. So we do have few separate videos for that. Again, come back to that. So this is 5 plus 5. So when you talk of this arrangement, the first thing that really comes to mind is that I have to somehow make a plan for these 5 subjects, because even if I leave all the others and go, still I am in with a very decent chance if I am able to answer the majority of questions which are being asked from these 5 subjects. As simple as that. Okay, the second thing that I need to know is, after having made this distribution, there are still about 10 or 15 questions that you are going to see. These 10 or 15 questions are going to be based on your MBBS knowledge. These are going to be from some path, some pharmac, some micro. So there are going to be some 10 or 15 questions like this. And these 10 or 15 questions also the reason why people who are very fresh from their NEET PG exam, who are just 3 years from their NEET PG exam, always have a much better advantage. And that's how history has been with respect to the exam. So I think this part is very clear. Once you know the 5 core subjects, let's just try to go back to what happened in NEET SS 2023. So I'm not just wasting too much time here. You have a video, please go and watch it on YouTube, which I've done in 2023, soon after the exam, on what I felt about NEET SS 2023. And the biggest point that I did mention in that particular video was cakewalk versus caution. It's actually a caution to people who are sitting and preparing, because the exam is not along your lines. It's more or less a cakewalk for those who are actually in the final year of their course, because the exam is so much in sync with how they learn. So if you're preparing for your final exam MD theory, then you're almost with a big advantage. The questions are very much like how we learned during our PG times. You don't need a specific preparation most of the time. Let's just try to look into that. So the most important takeaway messages out of the NEET SS 2023 exam was mostly there is nothing needed in addition to our MD final preparation. If you do your MD final preparation with real sense and with real purpose, that will actually take you through the NEET SS exam. There is nothing more that you actually need for the NEET SS exam. This is what we understood with respect to the 2022 exam as well as with respect to 2023 exam. So subsequent attempts are absolutely not required. Now, why I'm trying to tell this is again because many of the time, although I said this, some people don't get it in the first attempt because of the reason in that they feel that during their final MD, this is the time to read the textbook, and again keep reading the textbook. Now, reading the textbook is something which I am nobody to say is wrong, but my personal perspective on that is that it is not going to take you anywhere, because the core essence of the topic is, the hardcore essence of the topic, which you very easily understand out of watching a video in hardly 10 or 15 minutes, provided the teacher is reasonably good, is something that you may have to spend hours and hours to actually get from reading the particular textbook, especially something like nephrology, where you start reading a textbook and you start reading on AKI. You really don't know where to focus, what to focus. But if you do understand that, okay, these are the scenarios where I come across AKI, these are the scenarios that I'm again and again going to face in the hospital, be an ischemia related ATN, maybe a sepsis related AKI, maybe a snake bite related AKI, which can even be something like a papillary necrosis, or which can even be something like a contrast induced AKI, anything for that matter. So those kind of scenarios are what you actually need to learn, rather than reading theory from the book as we study in our 8th standard, 9th standard. So basically, if you study for your final MD exam with purpose and with some precision and exactly in the way it has to be, then this becomes more or less like a cakewalk to you. And can you actually wait for a year? This is something that I discussed in that particular video. It's perfectly okay to wait for a year, take a break, strengthen your medicine, because you may not go back to medicine later on in your life, strengthen your personal life as well, whichever way you want. And then you can attempt the exam. That's also perfectly fine. And if preparing after hiatus, what to do? Again, we have addressed there. So that again, we'll come back to at a later stage in this video. So essentially, if somebody is actually in his final year, he is in with a very, very good chance. Somebody who's passed the exam last year and just taken a break is also almost equal. There is nothing much of a difference. People who have actually given their MD exam 3-4 years ago and then coming back into the scene, for them, maybe that little bit of a hitch here and there when they start off is something which we are going to expect. So these were the most important takeaways with respect to the 23 exam. And let's try to now cater to the strength areas, how you actually center on your learning process with respect to the hardcore strength areas, or what we actually call as the hardcore areas. Now, 80 to 85% of questions have come from these 5 chapters, as I mentioned, and this is where we are actually going to go into first up. Now, after which I'll come back into the other subset, and we'll have separate discussions, separate videos with other subset by the specific faculties, the oncology faculty, the critical care, and the pulmonology faculty. So, from where have the questions come? From where are the questions likely to come? And what should I learn with respect to that particular subject is the first understanding that we need to have. So, we are trying to look at few subjects under the radar now. As I told you, 5 subjects are there under the radar, which are the utmost important subjects. And we will quickly scan through the other 5 subjects as well. So, starting off with the king subject, which I always believe is the most important subject in any entrance exam, NEET PG, NEET SS, INI, whatever it is, it's endocrinology metabolism, because there is no other subject which is as close to medicine as endocrinology and metabolism. Many people wrongly say nephrology is more close to medicine. That is utter crap. General nephrology in parts has something relation to medicine, but nephrology is a different science. Endocrine is not, so it's very much in sync with medicine. Let's see from where the questions on endocrine have come and what do I recommend with respect to learning that. So, endocrinology and metabolism has basically got 6 parts. The first part of which what we call is the bone mineral disease. Okay, so bone mineral disease is the first part that we are talking of. It's an extreme high yield zone with respect to NEET SS exam. You shouldn't ask me why, but it's an extreme high yield zone. In this extreme high yield zone of NEET SS exam, under bone mineral disease, 3 topics that have been consistently touched upon is hypercalcemia, hypocalcemia, and osteoporosis. So, hypercalcemia, hypocalcemia, osteoporosis. Now, hypercalcemia, hypocalcemia, and osteoporosis every time together have almost contributed to 5 questions. So, 4 to 5 questions. It's like seriously very strange. 3 topics. What should you be knowing about in hypercalcemia? In hypercalcemia, you should be knowing about calcium metabolism first. This is mandatory, because what is calcium metabolism? What is calcium sensing receptor? How is calcium and vitamin D related? How is vitamin D and parathormone related? What is the connection between vitamin D, parathormone, and calcium? What is primary hyperpara, secondary hyperpara, tertiary hyperpara? All these things have to be very, very much pakka with respect to calcium. Mostly it will be a route map question that you will get on hypercalcemia with respect to which direction to go. Is it the vitamin D direction to go? Is it the parathormone direction to go? Is it the parathormone related peptide direction to go? Or is it something like a thiazide diuretic causing hypercalcemia, a milk alkali syndrome causing hypercalcemia, or something like a FIO causing hypercalcemia? So everything is possible. It's a very, very important topic, and basics of calcium metabolism is also equally important. Then we come to hypocalcemia. Under hypocalcemia, what is really kind of stuck our eye every single time is this topic called pseudo hypoparathyroidism, and every single exam They keep on asking about PHP1, PHP2, 1A, 1B, Albright's hereditary osteodystrophy, pseudo hypoparathyroidism, how to differentiate between all this. Every single sentence about this is very important. A root map question on hypocalcemia is generally not asked. The root map question is generally on hypercalcemia. Hypocalcemia more or less comes in with pseudo hypoparathyroidism. So always keep that in mind. And do keep in mind that hypoparathyroidism, no? We talk about hypoparathyroidism. Hypoparathyroidism is generally a question that they tend to ask with respect to polyglandular autoimmune syndromes. Because in polyglandular autoimmune syndromes, we have hypoparathyroidism, especially in type 1 or APS1. So that's what they try to link. Osteoporosis is a must-watch topic. Osteoporosis is so very important. We have drugs with respect to the questions you get in osteoporosis are mostly with respect to drugs. So these are the three things that I want you to know as mandatorily with respect to bone mineral disease. Now, how do I study for this? So endocrinology and metabolism, when you open the app, we have different parts to learning. One is the medicine section of the NEET SS app, where you can actually see a detailed discussion endocrinology and metabolism, which is done at a medicine level. Because I'm not an endocrinologist, it is done at a medicine level. You have 24 to 25 hours of endocrinology being done there, and that will actually give you most of the things with respect to how you need to go about with this. Now, apart from this, so if you watch those 25 hours, you're in with almost like a 95 to 100% chance with respect to tackling most of the things. Now, the next level in that is basically what we call as the NEET SS folder under your Marrow SS. Under this NEET SS folder, you have a revision video. We have a revision video with pituitary adrenal diabetes like that. We have one revision video for bone mineral disease, which is done by Dr. Mayur, who is our endocrine faculty. And that particular video will actually give you a glimpse of the entire most important topics that come under this heading called bone mineral disease. If you watch that and then you watch the basic medicine videos, I think that's going to be more than enough. Now, if you want to go one step further, you can go to the endocrinology videos and watch the MCQ discussion series, which is done by Mayur. He has done MCQ discussion, not the original video. Original SS videos are much lengthy, so you can't finish that. If you go to the MCQ discussion videos there, again, if you do have time, I'm not saying it's mandatory, basic medicine content of these, which will come to around say 9 or 8 videos that I have done, plus the revision video which is done by Mayur, should actually help you answer this. Okay, so that's the first unit. Second unit that we are actually coming to under endocrinology and metabolism is thyroid. Again, very important. We've had so many questions from here. Easy part of the thyroid discussion is going to be a TFT interpretation question, which I've had all the time, which if you have basic understanding or if you watch my basic TFT interpretation video, you should be able to get through that. Then comes certain specific zones, thyroiditis, especially this question on Dicker-Vein's thyroiditis, which is the post-viral subacute thyroiditis, trying to compare thyroiditis with thyrotoxicosis, trying to compare thyroiditis with postpartum thyroiditis. All these kind of questions are very important. Then comes Graves. Now, with respect to Graves ophthalmopathy, the questions have come from three areas. One is the antibodies and the importance of each of the antibodies, even with respect to their sensitivity specificity. The management of a very important issue called thyrotoxic crisis, what to give in thyrotoxic crisis, how much to give in thyrotoxic crisis. Then with respect to the drugs that we use, the drugs are very important. The drugs like PTU, carbimazole, methimazole, and how you differentiate between them. The risk of developing particular side effects with respect to each of the drugs. These are very important. They keep on asking this. There may be very rare side effects also, but can come for the exam, like a Hirata syndrome that you get there, or something like an ANCA vasculitis that you get there. These are not common to see in practice, but they are very much important for the exam. The exact numbers with respect to agranulocytosis, the difference between these drugs, very important. And everything about Graves ophthalmopathy. There is nothing that you can actually miss on Graves ophthalmopathy, not the eye findings. Nobody's going to ask you the eye findings. It's with respect to the relation to thyrotoxicosis. It's with respect to treatment. It's with respect to different modalities of managing Graves and how it helps in thyrotoxicosis. It helps in GO, etc. So Graves ophthalmopathy is also a very important disease consideration. So this is from where the questions have come. There are two more areas under thyroid. One is hypothyroidism and the other one is approach to a nodule. Now, they have generally not gone to the extent of asking this hypothyroidism and approach to a nodule, but basic idea if you have with respect to approach to a nodule, and if you have a basic idea of hypothyroidism, that will definitely help you. Again, the number of modules that I have done with respect to thyroid are very few, so you can very easily watch, and one revision video which is under the NEET SS heading, which is done by Dr. Mayur. So that should actually settle the deal with respect to thyroid. We come to diabetes. When you come to diabetes with respect to the NEET SS exam, the core area has always been drugs. They have had this fascination of asking newer and newer things about the drug. See, again, you can come back to me. So many people have told me this, and so many people actually vouch this on YouTube as well. Let's see, this particular point about a drug has been actually mentioned and highlighted in this particular table, in this particular page. But then once the question comes and once you go and identify it from there, that's fine. But how do you how do you reproduce it for the exam? How do you study, assimilate, and keep it in mind with respect to the patient? How do you study, assimilate, talk about it on a platform? No, that doesn't make sense. So essentially, if I know something with metformin, with respect to metformin, that has to be helpful for me every single day, day in and day out, with respect to any patient whom I am treating. So that is the kind of knowledge I want. Rather than at the end, okay, this may be there in the textbook, that doesn't mean that you can go into every nook and corner of the textbook and cut, copy, paste the table, sit and mug up the table and make the whole exercise of learning so boring, so bloody damn boring. You don't want that. You want to enjoy the process, as Mahendra Singh Dhoni has said, and even I am also saying the same thing. The process is more important. How you enjoy the process is more important. The eventual result, if it comes your way, well and good. Even if it doesn't come your way, if you enjoy the process, at least you feel happy for the process. So don't torture yourself by taking tables, mugging up facts. Our subject is not that way. It's a life science, and 1 out of 4 to 4.5 people in the country are having diabetes, which means that we're studying to make a difference. Yes. So everything about drugs. Okay. Now, questions can come with respect to the side effects. Questions can come with respect to the interactions. So I have myself taken a long time in discussing drugs. You can see each drug being discussed in detail, but I think almost everything from that is very important. They have often asked a clinical question on HHS-DK, the differences between HHS-DK. So what's that module on? Acute complications of diabetes. The acute complication of diabetes is a very important module. There may be small differences here and there. So maybe when you say you know, but when it comes to the original question, you may little get confused between DK and HHS, or what we call as the hyperglycemic hyperosmolar syndrome. Infections unique to diabetes is a question that they always have a fascination to ask. So that's why we have not done it as one module, but I have mentioned it here and there. But if you do know these infections, emphysematous pyelonephritis, emphysematous cholecystitis, rhinocerebral mucormycosis, and malignant otitis externa, these are 4 infections, and even melioidosis to an extent, and post-streptococcal glomerulonephritis, not the original child post-streptococcal, the MRSA associated adult infection related glomerulonephritis, what we call IRG. These are all very unique to diabetes, and because they have this fascination about diabetes, they always keep asking questions with respect to this. So please have a know-how of that also. And different types of modi from where you get a straight one-liner question, modi 1, 2, 3, 4, what are the differences, that you can also see in my video. This, if you watch and you watch the revision video of Mayur, that's fine, that settles the deal. What I have not mentioned over here are the long-term complications: diabetic neuropathy, diabetic nephropathy, diabetic retinopathy. Diabetic nephropathy we include under nephrology, where you do get a question most of the time. Other things are generally not asked. Okay, so this is unit 3. So what remains? What remains is pituitary, adrenal, and gonads. Let's see what they have highlighted on with respect to those topics. With respect to the adrenal is a very, very important topic with respect to the NEET PG exam. But NEET SS exam, adrenal questions have all been centered on certain approaches. The first approach is how you approach endocrine hypertension. So endocrine hypertension by itself, I have done a module. Endocrine hypertension is again been discussed by Mayur under that revision section, and you can go to the MCQ discussion of Mayur under endocrinology, where again he has done this beautifully. So there comes lot of players. There are so many players in this, which means that we talk about hypokalemia, alkalosis, hypertension, right? There we have 5 players. I think if you remember correctly, we have cons, we have Liddle, we have apparent mineralocorticoid excess, we have glucocorticoid remediable hyperaldosteronism, we have Cushing's. So like that, you can draw a map from anywhere. And also it depends on the age and depending on so many other factors, what are the endocrine causes for hypertension. But when I say endocrine causes for hypertension, most often the question has been centered around cons. Sometimes the question has been centered around PO. That's why cons and PO are very, very, very important topics. Now, hypokalemia approach is the other question you get, where they may try to take you to RTA, renal tubular acidosis, and go in that direction, or they may try to take you to the alkalosis side, the Bartter-Gitelman side, where you have hypokalemia, alkalosis, and normal to low BP, or they may take you to the hypertension side, where any kind of question can come. Liquor is associated with apparent mineralocorticoid excess. So many of those questions. So any of this can come under the bracket. That's why extremely important to know endocrine hypertension, everything relating to endocrine hypertension, specifically knowing this disease called primary hyperaldosteronism, and of course pheochromocytoma. Hyperkalemia, how do you look at hyperkalemia? Sure shot, 100%. What should I know about hyperkalemia? Approach and all hyperkalemia, nobody will ask you. Under hyperkalemia, you should know about 4 things. First thing is the ECG changes with respect to hyperkalemia, which I have taught, Nishant has taught, everybody has taught. Second thing you should be knowing is with respect to management of hyperkalemia, what can make changes, in how much time does something act, etc. etc. Third thing that you must be knowing with respect to hyperkalemia is hyperkalemia has got a world of pseudos. That means the pseudo hypos. That means the pseudo hypoaldosteronism type 1, pseudo hypoaldosteronism type 2. So how do you differentiate between PHA1, PHA2? That means the non-renal causes for hyperkalemia, and hyperkalemia associated with chronic tuberointerstitial disease, that is tuberointerstitial fibrosis, resistance to the action of aldo. So those are the areas which actually they do highlight on. Then comes the sodium part. The sodium part is all about SIADH. Every single point about SIADH, every single point about acute hyponatremia management, and differentiating between SIADH and cerebral salt wasting syndrome. This is the next area. Hypernatremia is something they will not ask you. Then comes these 3 things: men, meon, PGA. After you study pheochromocytoma, automatically you go to men syndromes, automatically you go to meon syndromes, automatically you go to PGA or APS 1 and 2. How to differentiate between APS 1 and 2? Know each of the each of the meons properly. Multiple endocrine and other organ neoplasia syndromes, you are sure to get questions from there. Be it hyperparathyroidism jaw tumor syndrome, be it von Hippel-Lindau disease, be it Cowden syndrome, any of those things you can get any kind of questions. You have to be very sure with that. Carney's complex and all that. Okay. Then you come to pituitary. Pituitary, fortunately or unfortunately, has not been asked in detail for our exam. The question focus areas have many times been congenital hypopit, but now pediatrics is a different ball game altogether. I don't know whether they're again going to dive into congenital hypopit, but one module I have done on congenital hypopit, which you can see, where again we have tried to highlight on the important topics with respect to Kallmann syndrome, with respect to Prader-Willi syndrome, Angelman syndrome, all those things we have tried to highlight. And lastly, gonads. Now, gonad-based questions generally under endocrine, only for INISS they do ask these kind of questions, but we do get questions on 2 areas. One is called congenital adrenal hyperplasia, and the second one is what we call as androgen insensitivity syndrome. So that comes under that heading called DSD. So please watch my 2 modules, one on CH, that pathway. You don't have to know the pathway in detail and all, but what happens if 21-nitroxylase, what happens in 11, what happens in 17, what happens in 3. Then, of course, this issue of androgen insensitivity syndrome, and the basic know-how of what we call is DSDs, or differences in sexual development rather than disorders. So essentially this is what you need to be knowing, and you can see Mayur's revision video under NEET SS Marrow heading for 1 hour revision with respect to this. If you do have some more additional time, please go for the MCQ discussion videos done by Mayur under original endocrine, and that will actually settle it for you. Okay, so this is how you need to approach the king size subject, the first king size subject, which is endocrine. Let us go to the second subject. It's much more easier, and that is nephrology. Nephrology per se, if you watch the medicine part under nephrology, that in itself has been done in detail, because how much ever I try to curb myself, I cannot curb my instincts beyond a particular point. So whenever I start talking about nephrology, even though I think at the back of my mind that okay, this much is not required or this is not required, etc., finally I end up talking everything. It's very hard for me to hold myself back, because nephrology is something that is with me for some time now. Yeah, it's there with me for some time now. So because of that, it's always there inside me. Let's look into what have been the core areas for nephrology. Even if you don't watch the nephrology section under NEET SS, it's basically okay. Just have to watch the revision videos which are under the heading of NEET SS Marrow revision module. Sorry, NEET SS module, and also the folder, and also the original medicine videos. Inside that, what to watch. The first set of videos that I have done are all with respect to basics. Now, inside basics, they ask questions on one caste and the other one on the formulas that we use for GFR measurement, like the child equation, Schwartz formula, or something like MDRD, CKD-EPI, the issues with Cockcroft and Gault, how creatinine increases, decreases, all that very basic. And then, of course, the different types of caste, like the fracture caste they ask in myeloma. So, simple questions, but these are the 2 areas that you have to be knowing. Inside that, hypertension also. So, hypertension has 2 parts, right? One is the endocrine part of hypertension, and the other one is the renal side of hypertension, what comes under secondary. In this renal side of hypertension, they always ask about renal artery stenosis, and a lot of interesting questions come on renal artery stenosis. It's a very conceptual area. If you watch that particular module under medicine itself, that should actually settle it for you. And comparing a large vessel kidney disease versus a small vessel kidney disease like a thrombotic microangiopathy. So what are the main differences between the two? When do you think of thrombotic microangiopathy? When do you think of renal artery stenosis? How differently do the patients present? What is the difference between hypertension here and hypertension there? Why are ACE inhibitors contraindicated in bilateral RAS? Why are ACE inhibitors a drug of choice in something like a scleroderma renal crisis, which involves the small vessels of the kidney? So many interesting questions that way. So this is what you need to be knowing from the basic part. And once we come to core nephrology, the hot topic is always the glomerulus. The core topic always remains the glomerulus. Glomerulus is that one topic which you can study and easily get 7 or 8 questions. Most of the questions, if you know the basic part of glomerulus, is very, very easy. Let me just try to put it into shape. First, what you have to learn are the syndromes. And as far as syndromes are concerned, 3 syndromes: RPGN, nephritic and nephrotic syndrome. The difference between the 3 and the core examples for the 3. Second is under RPGN to focus a lot on ANCA vasculitis. Keep on focusing on ANCA vasculitis and also focus on lupus nephritis, which comes under rheumatology, but focus on ANCA vasculitis, focus on lupus nephritis. How do these things present? What we do primarily to tackle these cases, when to do biopsy, etc., etc. Then comes Goodpaster syndrome, which is also a kind of a RPGN kind of a scenario, but this Goodpaster's disease, Goodpaster syndrome, the antibodies, the presentations, the management, the plasma exchange, all that is very, very, very important. When it comes to individual glomerular diseases, MCD is mostly seen in children. I have not seen them asking too many questions on MCD per se, but that wonder topic is membranous. Membranous is a topic where lots of things happen day in and day in and day out. So that's why you have so many antigens. The antigen that was there once upon a time, PLAR, and now we have so many other antigens. Each day we see a lot of updates with respect to membranous. Even now we see facial creams and L1 associated membranous. So it's a very hot topic. So membranous, sure. Then so many of the secondary causes of MCD, secondary cause of FSD, secondary cause of membranous, secondary cause of MPGN, and they can ask you all that, and that's very, very important. So that's why initial glomerulus, all those modules are very important. Amyloidosis has been done in detail, so please watch amyloidosis, especially the table with respect to amyloidosis, knowing the primary, secondary, the causes, etc., etc. And hereditary glomerular syndromes, which is all about Alport thin GBM disease. Alport thin GBM, and if you have time, please look into Fabry and Neil Patella syndrome. These things actually constitute the hereditary glomerular syndromes, and very often we get 2 questions from hereditary glomerular syndromes. So this is one topic where if you learn properly, you can answer all the questions. If you have not learned anything so far, go for the basic medicine videos. That should be enough. If you've already done the medicine videos and if you feel you have time, go for the SS videos nephrology, but I wouldn't say that is mandatory. Medicine videos alongside with the NEET SS folder where we have done the videos, which actually have the points in Harrison, which are kind of added on, and I have made my remarks on that. Yes. Now, apart from this, what else to learn in nephrology? Apart from this, what else to learn in nephrology is critical care nephrology with respect to when to dialyze a patient in the setting of AKI. So that's why the settings in AKI and where you actually dialyze the patient, and what is your opinion with respect to each of the setting. One question on ABG in ICU, one question on ARDS in ICU. Again, very important. ABG basic interpretation, I think all of you having done your PG will be knowing. I don't think you have to learn that. ARDS in ICU is also something which all of you would have seen, and they generally ask a very simple question on that with respect to ARDS. The causes or something that way. This would actually be enough for nephrology, alongside with cystic kidney disease, which includes ADPKD, which is another hot topic which they keep on asking every time. So ADPKD module, if possible, do watch from the SS side, because that has covered everything. Even from the NEET PG side, almost 90% of things are covered with respect to ADPKD. Apart from this, the CKD part, the chronic tubulointerstitial nephritis part, the dialysis part, the transplant part, what a nephrologist deals with day in and day out is something which the examiners are not quite fond of. So fortunately, we don't get questions from those areas. If you are able to learn these many zones, I think you are pretty much safe. Okay. From nephro, before moving to the third core subject, let me just take a pause and look into rheumatology, immunology, because it's also very closely represented. Now, last year and year before last, the questions in rheumatology, immunology are at just NEET PG level only. So there is no preparation apart from medicine videos that you need. You don't have to see the SS videos. Just to do the medicine videos and do the NEET folder, SS folder, where we have done few more additional videos. Okay. Questions have been very simple. So even if you don't study anything in goals, so I think you are pretty much safe. Let's look into the questions in general. Psoriatic arthritis, mandatory one question on skin and nail change, something like that. Ankylosing spondylitis, mandatory one question on axial spondyloarthropathy, because now we know that there is non-radiographic axial SPA, radiographic axial SPA, etc. So based on the terminology, mostly you get one question. Behcet disease, sarcoid comparison, especially with IgG for one comparison question, 100% mandatory, but not going to be tough. It's going to be a simple question, like a lymphoplasmacytic infiltrate with storiform fibrosis or something like that. Lupus, APS and lupus nephritis is very important. Very, very, very important. But again, the questions have not been tough. So that's actually kind of a respect. You can ask even tougher questions there, but whatever they have asked so far has been very simple. Look into APS in a bit detail, because APS they can ask you questions with respect to who needs anticoagulation, who needs lifelong, who doesn't need, etc., etc. RA questions have been just on RA diagnosis and management. So with respect to RA factor, with respect to anti-CCP, the values of those things, with respect to not the numbers I'm saying, the real value, the use with respect to them, and with respect to management of RA, what to start and what to give and what not to give, what drug forms the backbone, etc., etc., those things. Apart from that, they generally don't ask you anything. Muscle is a question 100% you can get. You can either put it in rheumat or put it in neuro, but inflammatory muscle disorders are very, very important. Please go and watch that module in detail. Polymyositis, dermatomyositis, inclusion body myositis. Now we have a bigger spectra. Now we have cancer associated juvenile dermatomyositis. We have so many different types of dermatomyositis and muscle disorders per se, or inflammatory disorders of the muscle. So this is what has come from rheumatology. But again, I'm trying to repeat the statement that I made, that rheumatology questions are only at NEET PG level and nothing more. So that brings us to the end of our discussion with respect to endocrine, nephro and rheumat. From there we move to topic number 4, and which is basically the third of the big high yield zones with respect to the exam, and that is liver. Okay, so we move now to hepatology, which has a very fair representation, so it's really worth studying hepatology. Again, you can watch liver from the medicine videos. I've done liver in great detail. Liver is my personal favorite topic in medicine. And then we have revision videos which are done by Tarun under the NEET SS portal. That should be enough, because it's a very easy topic with respect to scoring marks. Let's see from where the questions have come. LFT interpretation basics, we've always had a question, sometimes 2 questions, and try to mix drugs with that, because very often you'll be asked as to which drug causes cholestasis, which drug doesn't cause cholestasis, which drug causes toxin-induced hepatitis. So that whole zone with respect to LFT, the acute interpretation, the chronic interpretation, the enzyme rise above 1000, the enzyme up to 5-fold, and with that alkaline phosphatase, ALT, AST, 100% important question. So that's the first part. With respect to individual disease, a disease that you have to be knowing in detail is Wilson, because every time we have had a question on Wilson, questions on Wilson have been very much centric clinical, or either gone into the ceruloplasmin and what to do and what not to do, which have been discussed in big detail. Then sometimes to compare Wilson with hemochromatosis, the clinical features of Wilson on an organ system versus that on hemochromatosis, that of hemochromatosis are also being asked. NASH, again, they have this fascination of asking NASH, and NASH is probably the most hottest topic. It is no more NASH, it is metabolism associated. So we can expect a question. It can come alongside diabetes, it can come in liver, but to know everything about metabolism associated steatohepatitis is becoming so important. And now, like, we are having more and more players coming into the fray, like the GLP analogs, semaglutide, tirzepatide. So many newer and newer players coming in. So I think for that matter, NASH very important. Conventionally, PBC and PSC have been important topics, primary biliary cirrhosis and primary sclerosing cholangitis, now called primary biliary cholangitis. Now, this topic also has warranted a lot of attention because of these so many different angles that this topic can have, especially association with Sjogren, RTA, and that one direction, the association with intrahepatic cholestasis and the basic approach to intrahepatic cholestasis, the association with anti-mitochondrial antibody and the linkage there to so many other antibodies, so that you can draw a lot of comparison questions, right? So that's why it's very important. PSC was asked last time, the onion skin fibrosis and all that. We have the cholangiography findings, and so very important topic. And so many basic questions have come in liver, like the ground glass inclusions or the Councilman bodies and all that what you learn at MBBS. That's what I'm saying. Whatever said and done, you are going to get few MBBS questions also. So there is no way you can skip that. It just depends on whether you remember it or not remember it. Okay. Alongside with hepatology, let's just quickly look into medical gastro. Now, medical gastro, when you ask me, is the easiest one to score, because you can learn very little, not even have to watch any other video, just to go and watch the medicine videos, medical gastro, few of them, and you can easily score. Questions have come from stock areas, stock zones. One is IBD comparison question, Crohn's versus ulcerative colitis. Either it's based on histology question or it's based on clinical features. Just to know that Crohn's can involve anywhere, and ulcerative colitis is proper proctitis or proctosigmoiditis colitis, or sometimes proctosigmoid or colitis. So it's a continuous involvement. That itself will settle the deal most often. UC is a more superficial and Crohn's is much more transmural. So that will actually help you. Celiac versus Whipple, very important. Celiac can come anyway, anytime. Celiac is like, it can appear in the question paper anywhere. It can appear anywhere. It can come as a diabetes question. It can come as a fracture question. It can come as a malabsorption question. It can come as a cerebellar ataxia question. You can't predict how celiac can present in front of you. Knowing Whipple also, out and out, very important. Whipple came as a neurology question last time. So no celiac, no Whipple, no tropical sprue, know them out and out and know how to compare. B12 pathway is another pathway where you are going to get a question. Even though we are not doing any shilling or anything now, still everything about B12, right from the intake to different aspects, to the intrinsic factor, to pernicious anemia, to all those things are actually speaking very important. Another infection related question that does come from medical gastro is Clostridium difficile related infection management, the pseudomembranous enterocolitis. This Clostridium difficile infection is something they keep on asking. So please know the severity, the ranges to use vancomycin, when to use metronidazole, very important. We've also had questions on the cells, Paneth cells and crypts of Lieberkühn and interstitial cells of Kajal and all those things. The basic physiology of GIT have also been a major point, enterochromaffin cells and all that. So that's again done at the beginning of the module. So please do watch this. This is a very short video, short topic where you can actually score a lot of marks. So this is about medical gastro. From medical gastro, we look into infections. Many times we don't study infections and go, but still escape, because your basic knowledge of infections is what that matters. You can't read Harrison infection in toto. Nobody can teach you also infection in toto. So what we have tried to do here is, apart from the few videos in medicine that I have done for infections, you can also see the NEET SS folder where our faculty for infections, Ankit, has actually tried to condense infections into two separate folders, two separate videos, and try to deliver his best. But from our experience, a question on lepto and scrub, very important. Even if you can take up to date and read everything about lepto and scrub, also take only less time. But please do, because we can get a new question. They could ask you things which are out of the box in infections. That's what I have seen. The toughest part of the paper last year, not last year, 25, we didn't have the exam, 23 and 22. For me, if you ask me personally, when I review the paper, for me, the toughest questions have come from infections, because they've taken that whole chapter from Harrison and tried to put questions from here and there, which is practically not possible. If you ask me Coxiella Burnetti, what do you do all of a sudden, then I'm always confused. So it's not like I can relate to what I have done and do. So please, these two, very important. Dengue, one question mandatory, but most of you will answer that because you managed it. Pneumonia, again, mandatory. Pneumonia can actually watch from my videos. You can watch the Palmoside videos, curb 65 score and everything, very important. Infective endocarditis, again, sure short question. Nishant has done it in detail. I've also done it. So again, you can watch that. Candida is another very hot topic. They tend to ask a lot of things with respect to candidas. If you read candida in detail, that can help you. Meningitis, CSF interpretation, especially with respect to cryptococcus. So cryptococcal meningitis, comparing that to different other forms of meningitis, basic CSF analysis and all that. This is what has actually been asked. But more than you studying this, it is your know-how that matters here. But specific zones, if you can always study. But the toughest topic to teach personally is also infections, because there is no end to it. There's absolutely no end to it. So please go and see this, and few maybe questions on antibiotics can also come. So again, no specific module is there, but it's been like touched upon everywhere. So I recommend you to watch the basic infections module that I have done, individual infections from the respective chapters, and also the infection revision done by Dr. Ankit. Okay, another subject where we have had questions, very few, but again been very easy, is hematology. So hematology, I think most of the time, even if you skip hematology and go, still you may answer the questions, because questions have been very simple, just like rheumatology I was talking of, very simple. The most touched upon topic has been multiple myeloma. They've asked everything about multiple myeloma, but only at a very superficial level. They've been gone on and asked tougher questions. All have been very simple, like the Dutcher body or the Russell's body or something like a beta 2 microglobulin. They've all been simple questions. But do learn myeloma in detail. Don't have to specifically go and watch the hematology videos. My videos for medicine are enough, and with that you have to go to NEET SS and watch our faculty's revision videos, which will give you the most important topics at one glance. That should be enough and more. CLL is another topic that they have touched upon, again in a very basic level. DLBCL, follicular lymphoma, and all those markers, the BCL2, BCL6, double hit, triple hit and all that, everybody is fond of asking, so you get questions. ITP management is another topic where they will ask you, because there is some confusion there, first line, second line and stuff, and maybe give a cell to identify. based on flow or based on morphology. So you can actually get a question that way also. This is what has come from hematology. But again, I'm telling you, hematology has been actually on the easier side. Genetics has also been that way. If you watch those two videos, I think that should be more than enough. Even if you don't watch that and you have a basic MBBS level understanding, you should get through. Biostatistics, I have never studied any biostatistics, so I wouldn't recommend someone to learn biostatistics all of a sudden. But we do have videos for quick revision of biostatistics. If you feel maybe 3 or 4 questions can come, of which 1 or 2 everybody answers, especially if you've done your thesis pretty seriously. The other 2 questions, if you can think that, okay, even if I answer it, let it be. But if you want to study and go for it, of course you can. So now what remains? What remains are the 2 big guns, the big giants, who actually make us sweat a lot in the ward as well as for the exam. And even for 23 exam, the 2 most important giants were neuro and cardio. Why I call them giants and call endocrinology the king is, you can still approach the king, okay, because there's a way or modus of approach to endocrine. You can tackle it. Neurology questions of 2023 exam were extremely high standard. They were very high standard. I'm so happy that we have a faculty like Bashek who has systematically organized everything into that one folder. His original videos in neurology are a real delight. If you keep watching that, you will yourself fall in love with the subject. I have myself, after having left my PG course, I haven't had any exposure to neurology except for the patient with CKD who presents with uremic seizure, or maybe for some odd case of GBS transverse myelitis we do see here and there. But he has made me once again fall in love with neurology. But apart from that, what I'm coming to is about the original NEET SS revision videos that he has done, where he has concised such a huge subject like neurology into hardly 16 hours or 15 hours. But that's really worth its weight in gold, because the kind of questions that have come last time. So many of the questions that have come last time are very tough with respect to neurology. So even if you miss, it's fine, because most of the people won't answer that. But where have they focused on, if you ask me? Epilepsy and epileptic syndromes in general, but anti-epileptics as drugs, migraine drugs, Parkinson drugs, antipsychotic drugs, all in detail. They've gone into every nook and corner with respect to the drug, and I think it's covered all the important points with respect to that. So please have a very clear idea with respect to drugs used for each of these diseases, and also epilepsy in total. Muscle dystrophies and proteins are mostly a one-liner question for which dystrophy, which protein, which dystrophy, that protein. So that's again a table and a basic understanding that you need to have. The MS-NMO spectrum and the MOGAD and all those syndromes with respect to that, and the basic comparison question between MS and NMO and ADAM. Again, very important. 100% sure shot question, myasthenia. Anything and everything you can expect from myasthenia. GBS and variants, the AMA and AMSAN, the Miller-Fisher variant, and a question from there, maybe clinical or otherwise. GBS transverse myelitis comparison question. Again, CSF-based questions on meningitis. That's where I was talking of cryptococcal meningitis, very much like their hot favorite, and comparing that with bacterial, viral, tubercular, and all that. This is just a glimpse of what neurology has to offer. There are many more topics inside this. I was not able to kind of come to a conclusion with respect to what is important and what is not important, because neurology has been tough. And because neurology has been tough, I would recommend you to watch those NEET SS videos that he has done under the revision folder for the NEET SS exam. And I think that should be pretty much enough, and you have also got a decent neurology understanding. The subject that we know the most when we pass out of our course is generally neurology, more than anything else. So I think on that note, I expect you to have a much more keener interest in the subject and look into the subject in a bit more detail, because out of the 5, if you ask me, I would rate in terms of the number of questions. I would say endocrine is 1, neuro is 2, cardio is 3, nephro is 4, and hepatology is 5, which means that we have had a large number of questions from here. Finally, cardiology also last time was a little difficult paper. This is Nishant's own slide where he has talked about the paper and said it's very factual. Unusual areas, less clinical scenarios, and more factual questions, and in fact total 19 questions, of which 4 questions are kind of overlap, but the remaining questions are core cardiology, of which few of them were extraordinarily difficult. What do you learn from cardiology, if you ask me? JVP, of course, from basics, where you're getting a sure shot question. Cardiomyopathies in detail, including HCM, including RCM, amyloidosis and RCM and constriction differences, RCM and constriction differences, constriction and tamponade differences, diuretic cardiomyopathy management, that's again equal to heart failure management, hyperkalemia, ECG, pulmonary thromboembolism, very important. And I'm telling you, rest is luck. There are so many other questions which we can't even decipher. Even Nishant himself calls this as very tough. So this is in general what we study. The STEMI and STEMI management and all that is not so commonly commonly asked. So like getting ECGs of STEMI or NSTEMI and all that is again not so common, but you can get any scenario like that where you are asked to give an advice with respect to what is to be done. So just to have it in mind, but not going too much of detail into ACS on the whole. So this is what I feel we have to be learning going ahead to this exam in 25. But again, I'm having my own reservations. Why? Because of different reasons. One, that the pattern keeps changing. Second is that we haven't had too many exams. So we're just talking with the experience of 2 exams. We really don't know whether they can spring in surprises. So many things. But on the whole, if you are basically good with these many topics, whatever be the pattern, you should still get through. So that is essentially what I want to again and again reiterate. So what does Marrow have for you? So Marrow has so many different folders under this Marrow SS app. So what you should be focusing here is the general medicine folder and the revision folder. The revision folder which is named as the NEET SS folder. For inside the NEET SS folder to try and finish off all the revision videos that have been actually posted alongside with the medicine content that I have told you with respect to the questions asked for the exam. For people who are preparing for INA, naturally they'll be going for subject videos. For people who are preparing for NEET SS who really don't have time, there is no space or no time to actually go for the subject videos. So that's why I'm not actually telling you. For the others who are preparing for a long time, they would have maybe watched subject videos, especially those who are trying for INA as well. Now, apart from that, this is the NEET SS folder, what we actually call as the high yield series. Okay, we do have lot of grant tests. Okay, so grant tests are there on the app. We have different types of GTs, all exam oriented GTs. Even the old GTs are now there on the app, and we have a team working day in and day out to give you the best questions with respect to the GTs. The GTs add much needed fillip to your preparation and make you feel much stronger. Don't ever get disheartened doing the GTs. They are intentionally kept tough so that you feel much better, because as I have said this so many number of times, and I myself didn't know the statement became a hit, right? That means if you get a question for the exam which is one step below the level at which you have prepared, then easily you will answer. If you get a question which is one step above the level at which you have prepared, you will never answer. But the question that makes a difference for the exam is the question that comes at the same level at which you have prepared. But in the heat of the exam, you may not be able to answer a question that comes at the same level at which you have prepared. And that is why it is imperative or mandatory to always prepare one step above. If you prepare one step above, then automatically the exam, whichever be the exam, whatever be the exam, you are going to crack it. So that's essentially what it is. And finally, yeah, we are with you, but then we are not hugging you. That's what I'm trying to make very clear. That means you are all grown up people. You are all well and truly into your 20s, and you are well and truly, some of you are married and some of you are like, you're well and truly on with your life, and you're well and truly actively leading your life. And you don't need this kind of teacher coming to you every time with you, every time messaging you, every time hugging you, every time telling I am with you. It is absolutely not required. It's more a kind of an irritation rather than anything else. You're not actually helping you prepare for a NEET UG exam. I think you've seen the videos of teachers, how they teach these students for NEET UG exam. That means to tell them again and again that, see, I am with you, whatever happens, I am there for you, you're going to get the exam, you pray hard, you work hard. Last year someone so came with 1,20,000 and then ended up with 1,200. So everything is possible, everything we can actually achieve, we need to be together. And then again giving mnemonics and quotes. That's how you have to teach for a NEET UG. If I go and become a teacher for NEET UG exam, then I think it's going to be an utter disaster, because this is not the kind of teaching that you need for NEET UG. I'm not trying to say that for NEET PG I became a huge success. It's not that way. But then I know that for NEET UG I'll be an utter disaster, because of the reason that there you're not supposed to be presenting facts exactly the way it is. You have to give them that much needed boost. Keep on boosting them, because they're very small children. They're only 17 or 18. But here that is not the case. You are well and truly beyond that. So again, to be with you and hugging you every day is not required. You know to do your job. It's just that fillip here and there that we need to provide. And that's been the aim of the app also. That's why you can't see the faculty coming every day. You can't see the faculty coming every other day and coming and telling you, you study this, you study that. Whenever somebody sends me a message asking for what advice you have for our PG course, I say it's your PG course, it's your life, and it's for you to decide. But when a final MBBS student actually messages me with respect to what to do, can I message him that way back? It's not possible. So postgraduate, once you are a postgraduate, you just imagine you are at a much higher plateau. So you should be making decisions for yourself. So finally, if you feel that you haven't prepared well enough and you want to still make a match of it and there isn't enough time, no, you're wrong. There is enough time. And as I said, whatever I've told you to complete that takes hardly 20-25 days, and you can even revise that once more. So you're having enough time with you. The more important decision is like with respect to whether you need to go for a DM or you don't have to. Once you've decided that you're going for a DM, then 100% you are having a very, very good chance. And not just that, if you're in your final MD and you're giving the exam for the first time, you have a striking advantage. So if you're planning for a DM, I think it's better to get it done as quickly as possible. But there's nothing wrong in taking a break. Absolutely nothing wrong in taking a break. For people who are coming back after a hiatus, maybe 3 or 4 years, for them also there is nothing to feel disheartened. They have the game right there in front of them. So you just have to follow what I've said. Not that this is the absolute mantra for success, but I think this will more or less, I think, strike, because these are the topics, and if you study those topics, invariably you get it. It's a very important exam, I feel. It's a very important decision also in your life, because at that time we are in love with medicine. We think of whether really have to go to another subject, etc. It's a big dilemma that everyone has, and even I had that dilemma. But I was very clear at the back of my mind that I have to do something else, which I know from the beginning itself I was very clear with. So anyway, once you've made a decision like that, of course, this is the exam for you to go forward. And don't ever think that INI offers anything superior. We have really top colleges for hunt in this particular exam, that SCBGI, CMC, Vellore, Madras Medical College, Trivandrum Medical College, Osmania. So many good colleges up there for grabs. So you basically can take it up. And basic science and MBBS learning matters. That's what I'm trying to tell you right at the end, that even though we discussed all these things, your MBBS knowledge will come in handy. There will be some micro questions, some patho questions, some pharma question. So just take it in its stride. Just think that if you get it, you get it. Otherwise, you don't. Biostatistics, I wouldn't recommend you wasting too much of time learning that. But if you can learn some basic things like median, mode, chi-square test, or something like your basic questions, I think that should be enough. And always remember, freshers have a striking advantage. The exam pattern is that way. Somebody who is giving the exam after his MD is the favorite here, in contrast to the exam 3 or 4 years ago, where repeaters had a striking advantage. When you talk of NEET UG, you say no, repeaters have a striking advantage. When you talk of NEET SS, you say freshers have a striking advantage. But in spite of that, everybody is in with a chance. There are a lot of seats for the taking, and it's about you getting the seat that you want in the right place, so that it actually gives you the much needed fillip to your career. Because it's a kind of a ball game now where it is very dicey. You really can't say whether doing a specialty is better than sticking with medicine. You really don't know. So it's up to the individual to take a call on that. Like, unlike when I was studying, where the seats were far and few, and once you get into a specialty, you are more or less settled. That's what the whole idea was those days. But even the word settled is something which people don't use now. So essentially, times keep changing, thoughts keep changing, priorities keep changing. So that's how it is. And as far as our entire team is concerned, we're always trying to deliver you the best. But as I told you, not trying to hug you, but actually be at a distance and trying to help you in whichever way we can. And as far as 2025 is concerned, we are trying to come up with what is called as gateway to residency. And I am very hopeful that that will strike a kind of chord that we need to, with respect to the first years and second years who sometimes caught off guard and who really don't need any of these things, and are just finding it difficult to cope up with their work in the ward. So I think it's something for them. And with respect to the case discussions that we have on the app, we already have, I think, 7 or 8 cases. We're trying to add a few more cases and finalize with respect to all the important case discussions that you need with respect to your final MBBS practical exam. So on that note, I'm signing off and wishing you the very best for NEET SS 2025. Thank you.